AAO just represents a great opportunity for our company to showcase our products to doctors all over the world.
Our company is now just 3.5 years old, and being here at the AAO gives exposure to Alpheon to the entire ophthalmic community.
It's a great way for 2020 EHR to be able to represent all of the products in our portfolio to the marketplace.
The exhibit floor is open, and now you can experience the largest exhibition of ophthalmic products, services, and technologies in the world. I'm Rachel Kopchak, and this is AAO TV. One of the many benefits of attending AAO 2015 is having the opportunity to take a seat in the Technology Pavilion to hear free presentations on technology trends and tools, including the latest in 3D photos. With a 3D patient scan, you can look at different views, see subtle changes, and have multiple views in one object instead of multiple images. This is beneficial for telemedicine and distance-based research and is going to be used more frequently in the future.
I think 3D is sort of the next step. With patients that have baseline photos and follow-up photos after surgery, for example, rather than just a two-dimensional image, it'd be nice if we had some 3D data.
Research, tools, and care for glaucoma were featured as part of the subspecialty program. Dr. Michael Cass presented results from the Ocular Hypertension Treatment Study, also known as OATS. The study began in 1993 and is currently in phase 3. The groundbreaking findings so far show that early treatment does have a protective effect over the onset of open-angle glaucoma in people who have elevated pressure but no damage at baseline. Dr. Cass says they've also come up with a prediction model with these 5 factors: age, level of intraocular pressure, central corneal thickness, measurement of the vertical cup disc ratio of the optic nerve, and the PSD from visual field.
This would give you some opportunity when patients ask you, "Doctor, what's going to happen to me?" We can start talking about what might happen to them in their lifetime rather than in the next year or 2 years. We hope to add some additional information so that the patients' clinicians can sit down and discuss the situation and make good decisions.
There was standing room only in this panel discussion on managing cataracts. Several cases were presented, and audience members were able to text in any questions. The panel touched on new medications being used, like intravitreal injections of antibiotic steroids instead of drops. Dr. Terry Kim, who moderated the session, believes femtosecond laser technology will be used more and more in the future for both straightforward and complex cases.
There are a lot of surgeons using it for dislocated lenses or subluxated cataracts, for dense cataracts, patients who have mature white cataracts. These are all scenarios that can really benefit from a capsulorhexis or lotomy that's already going to be formed prior to entering the eye and having assistance with disassembling the lens.
There's more AAO TV after this message.
Coast to coast, dusk to dawn.
SightPath is on the move.
Mile after mile, all year long.
SightPath is on the move.
Our 200 employees travel 3 million miles a year
to help our customers provide quality care close to home.
All we do is eyes.
All day, every day.
Every day.
Join the movement.
Welcome back to AAO TV. I'm here with Nancy Baker, the 2015 American Academy of Ophthalmic Executives Chairwoman. Nancy, it's great to be with you.
Thank you. It's good to be here.
Yes. So tell us more about AAOE.
AAOE is an organization, it's the practice management branch of running a whole medical practice. It's a great organization of volunteers, and we have practice management information, we have coding and billing information, we have government and compliance information, all readily accessible for the membership at any time.
What are some of the other benefits for members to be a part of AAOE?
It's a great question. And the thing that I love about AAOE is the amount of benefits we have. We have, of course, the IRIS registry so that you can get PQR PQRS compliance and all of that very, very easily. It's simply mapped and it's all free member benefit. There's also benchmarking surveys where you can find out how your staffing meets up with other people, whether your billing is compliant, all of that. And it's an annual survey and it's a member benefit. You get those results for free so long as you participate. There's also a salary survey. Salary surveys are often very expensive. If you participate, and it's an open survey that never closes, so it's all real-time information, if you participate, you get that for free so that you can find out if your one tech who swears that they're being underpaid, whether or not they really are. So it's a great benefit to have.
And what's new and exciting that you guys have happening here right now at AAO 2015?
This is a great meeting this year. The practice management is really becoming an important focus of a successful practice. And people realize that with everything changing so quickly, they need the tools. And so it's exciting to see all of the new administrators here, the new courses. There are 57 out of 99 courses are new. And the membership has been able to control that and make sure that the membership gets what they need from this meeting. And this is where it's working. The networking here is off the chain.
Yes, it is off the chain. And if you want to learn more about AAOE, you can stop by their booth down across from Casanova 501. Thank you so much, Nancy.
Thank you.
Another hot topic at AAO 2015 is lean healthcare. It's a management strategy that was first pioneered by Toyota to reduce waste. It's now being used in healthcare. By focusing on the patient's experience, lean healthcare helps meet the constant demand for improving patient value and satisfaction. It does so by examining the patient processes in the practice from the time the patient schedules an appointment to having their surgery to billing.
We know that people can sometimes be part of the problem, but Lean looks at it and says most of the time when there's a problem with efficiency or things aren't going smoothly in your practice, it's a problem with faulty processes within the office.
While you're on the exhibit floor, you'll want to walk through the new exhibitor Pavilion. You'll be able to discover all of the new companies that are exhibiting here at AAO 2015 all in one place. Stop by the Academy Resource Center to take advantage of once-a-year services and special promotions like the chance to win an iPad. It's your single stop for everything Academy in Las Vegas. Get answers, claim CME credit, pay dues, and purchase the latest Academy products. You can join in on the conversation on social media. Just use the hashtag AAO 2015. I'm Rachel Kopchak, and you're watching AAO TV.
I want to help.
I want to make a difference.
I can help you.
I want to be able to look my patients in the eye and say, we can do that.
I have high standards, and I want to be able to deliver on them.
I don't want red tape.
I want to innovate.
I want to collaborate.
I want to feel that passion again.
I want every patient to know that I'm not just some standard.
I love my calling.
I love what I do.
Because I'm their doctor.
And I am Alphion.